Support for Radio Friends comes from IT Como, offering computer and IT services for small businesses and residential clients. IT Como can set up remote work-at-home solutions and data security and backup systems and upgrade your company email to more modern platforms. IT Como can also help you get the most from your technology at home. Learn more at itcomo.com. Good morning and welcome to Radio Friends on Friday, August the 18th. We have a wonderful doctor with us today, Dr. Anand Chockalingam from Truman VA Hospital. Good to have you here.
My pleasure. Thanks so much for having me, Paul.
Here's the guy who you tell us to smile, 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 because the more we smile, the better it is for us and the longer we're going to live, right?
20 times an hour.
20 times an hour, smile. Now, we're going to talk about blood pressure here in just a minute, but that philosophy of smiling, why is that so important?
I didn't realize how important it would turn out to be, but it is becoming more and more part of what I do in helping my heart patients. As children, we all smile 40 times an hour. But then as we grow and become adults, from 40 it drops all the way down to 1 or 2 smiles an hour. So when I ask for 20 smiles, it's quite a bit. But I remind my friends and patients, it's not even half of what you did as you were growing up.
So when we were growing up, you're saying that we were smiling about 40 times an hour?
Yes.
Now, does it count right now? I'm sitting here talking to you, and I'm smiling because I look at you, and you're contagious. You make me smile.
Definitely,
that kind of smile
definitely
counts.
It counts. That's what we are talking about. And then when we keep making it a habit, then at the subconscious level, we find reasons to be connected with people around us, find reasons to be more trusting and grateful for life itself. So the external smile can make internal changes. And that's what we are seeing, helping so many of our friends and patients.
So by smiling, we gain trust with each other, which then helps lower the stress level. So that smiling really does make a difference.
So this is the core of how we are able to really help so many of our heart patients dealing with metabolic problems like hypertension, diabetes, excess weight. We are helping people get so much better, feel 20, 30 years younger because they understand the core value of this optimism and positive psychology.
Smiling 20 times an hour. Now, what if you're by yourself, okay? And you just go look in the mirror, or you're sitting down and there's nobody in the room and you just start smiling. Does that still count? Does it help?
It means you're blessed.
Okay.
If we can smile, we don't need reasons to smile. The logical mind needs the reasons.
Yeah,
but
you're blessed.
In their nature,
blessed.
We can continue to be celebrative.
Well, we came out here today. You wanted to talk about blood pressure today.
Yes.
And usually when you go to the doctor or we take our blood pressure, we're told to sit down, be quiet, don't talk, put your feet flat on the ground, and you're resting your arm and wait about 5 minutes and then take your blood pressure.
You said it exactly the way the guidelines ask us to do it. Now, I think close to 100 years, this is how we've been checking it.
And the other thing that I do before I take my blood pressure is I'll take in a whole bunch of deep breaths, breathe very deep. And I find that if I do that,
it's
and
even
just kind
lower.
Meditate a little bit.
Yes.
My blood pressure will be lower.
That's very intuitive of you to do that because you are improving your vagal tone and reducing your sympathetic, increasing your parasympathetic tone. And that's how your blood pressure drops within seconds by taking a few deeper breaths.
Yeah.
That's amazing that you figured it out on your own.
Oh, yeah. Well, I think I was told to do that. And whenever I go to the doctor, before they do my blood pressure, I always have to sit quiet and I do those deep breaths so it comes back better. But you're talking about today, you wanted to touch on the fact that maybe we need to take our blood pressure while we're standing up?
Yes.
Why?
We took it to the American Heart Association, the most recent meeting in Chicago, and we presented our own experience where when we measure blood pressure sitting, it's okay, whatever numbers we see. We'll talk only about the systolic blood pressure, just for simplicity's sake. Systolic blood pressure of 120. When people stand up, about 5% of the time, it drops 20 points, 30 points. It's called orthostatic hypotension. And
So when you stand up, your blood pressure drops?
Drops 20, 30 points. And it happens in 5% of people in the society. But it happens more if they are on blood pressure lowering medicines, especially diuretics, especially older age or with neurological conditions like Parkinson's. So it's very important for people on blood pressure medicines long term to know that their standing blood pressure is not dangerously low. So that's important. It's called orthostatic blood pressure checking, and we recommended it for the last 30 years. So we do check it. It's not like standing blood pressure is never checked. But what we are finding in our own practice is not only the drop of 20, 30 millimeters mercury, sometimes on standing up, we are seeing 30 or even 40, 50 millimeter pressure increase on standing up. That is something which took me by surprise a few years ago. So we started checking it more regularly, and now we've made it a routine. Because people with so many challenges, their blood pressure starts shooting from 120 systolic all the way to 150, 160 on just standing up for a couple of minutes. That's why my request to our community is, if you have blood pressure issues, if you are taking medicines, take your blood pressure readings to your doctor. Every time you go visit them, that will help your doctor adjust your medicines. But if some of those readings are while you're standing for a couple of minutes by the dining table, when you click the machine, that's going to help your doctor.
Okay, so when we take our blood pressure at home, just monitoring our blood pressure, and I do that from time to time, you're saying I should also take my blood pressure standing up?
That would help.
Should you stand up immediately and then take it, or should you stand up, wait a minute or two, and then take it?
This is excellent. As soon as we stand up, it fluctuates a little bit. So that's why after standing in the same place for a couple of minutes, 3 minutes, that would be ideal. 2 to 3 minutes after standing in the same spot.
Take your blood pressure then.
Exercise, we know, increases the blood pressure, and it's normal for exercise to increase it. But because more and more people work in desk jobs, they're not getting much exercise, just standing up ends up becoming a stress, like being on the treadmill. So I feel that is the reason why blood pressure shoots up so high for a lot of our people, and it overlaps a lot of times with extra weight in the body, stress in the mind, things like that.
So what should you do if you take your blood pressure standing? You stand up, wait a couple of minutes.
2 to 3 minutes.
Take your blood pressure. And what if it's a lot higher when you're standing than when you're sitting?
Write these down, take it to your doctor. Let them guide you how to move forward.
Okay. I never thought of that.
For the last 100 years, doctors didn't think about this, the higher pressures. But now, slowly, we are waking up to the newer challenges that modern way of life is bringing to our society.
Okay.
That's why you are an opportunity for us to spread these simple messages to our community.
Oh, I appreciate that, Anand. Thank you so much. It's always a pleasure having you on, and I learned something new today. I'm going to take my blood pressure standing in the next couple of days or so. All right?
So nice to see you.
Will you come back again?
With pleasure.
All right. And if people want more information, what do they do?
I'm at the VA. Anytime they can reach me. I'm at the university. So.
Okay. And you have a webpage also, right?
Yes.
Okay. But we're out of time for today. Anand will be back with us again soon, and we'll continue that. Drop me an email, pepperp@missouri.edu. Have yourself a nice day. Bye-bye.